Jeff, for 10 years we ran a pain center together, and we watched as patients would grow from a purely sensory understanding of their pain to an understanding of how it affected their lives. Can you tell us more about how that was accomplished?
So patients came to us like they come to most providers' offices with an emphasis on sensory aspects of pain. They focus, for example, on the back and how it's painful to them. We're trying to move them to a broader, more comprehensive understanding that includes behavioral factors as well as sensory factors in understanding their pain.
And so tell us how you did that, and how would a physician in their office help in that framework?
So before we start to move them, I think we need to understand where they are, what their understandings are of their pain and their belief systems. So we try to you'll see in the example to follow that what we try to do is elicit a sense of what the patient believes about their pain. And that's where we start then in the process of trying to move them to a more comprehensive understanding.
So Jeff, what should we be paying attention to in the interview that's about to happen, and what does the process look like?
So I'll first begin to define their belief system and what they understand the pain experience to be driven by. Most everyone comes with a pretty clear understanding of mechanical elements of pain, sensory elements of pain. But what I'm going to be trying to explore now is how they interpret their pain experience, what emotional accompaniments they add to their experience. Are they aware, for example, of the role of stress, or are they aware of the role of other emotional factors? And as we try to elicit that kind of belief system, we begin the process of developing insight in our patients so they understand better what the comprehensive contributions to their pain experience are.
So if I understand correctly, what you're saying is that the very process of asking the question can actually open them up to insight if they're ready for that change.
Yes, and then we'll often ask them to go away from the session and pay more attention to the very things that have come up as a way of expanding that insight over time.
So you would typically give them some homework right from the very first visit?
Yes, we use homework as a way of expanding on the interaction that we have in the office and helping our patients begin to attend to these elements in their everyday life.